Post-transplant monitoring and maintenance requirements. Lifelong maintenance and monitoring. You will receive a schedule of your post-transplant testing and appointments from your transplant coordinator. You will need 24-hour assistance for at least 6 weeks after the transplant. You will be expected to have a primary and a backup caregiver. You cannot drive for a minimum of 6 weeks after surgery and cannot lift anything heavier than 10 pounds for 6 weeks after surgery. If you live a far distance from UCLA, please be prepared to stay near UCLA for the first 2 to 6 weeks after transplant. This will be discussed during your evaluation period with your doctor and your social worker based on your individual situation. Lifelong maintenance and monitoring. Regular clinic visits with the transplant team are critical. Several tests will be done to monitor the function of your new heart and check for rejection, such as heart biopsy, echocardiogram, angiogram, blood tests to check your drug levels and other values, electrocardiogram or EKG if irregular heart rhythms are suspected. You cannot smoke, drink, or use controlled substances after heart transplantation. Regular exercise and stress reduction is encouraged. You must maintain proper cancer screenings such as mammograms, pap smears, prostate examinations, colonoscopies, and dermatology visits, and see your primary care doctor regularly for routine non-heart transplant care. Going back to work and having a normal life is expected after transplant in most situations. Please discuss your individual return to work and traveling plans with your doctor. Having a transplant does not mean that you are permanently disabled or cannot travel or participate in most activities. Lifelong maintenance and monitoring. You must take your medications as instructed for the rest of your life and not run out of your medications. If your insurance coverage changes, call us immediately. The monthly cost of your medications and your insurance deductibles depends on your insurance and will be explained to you prior to the transplant listing by a financial coordinator. Notify your doctor or coordinator immediately if you have a change in medical insurance, as this impacts your medication and follow-up coverage. Potential risk following transplant rejection. Signs and symptoms of heart transplant rejection for which you must call us immediately. Feeling very tired or weak. Fever of 100.5 degrees or fever, chills, or sweats. Shortness of breath at rest or with light to moderate activity. Fast, irregular, or skipping heartbeat. Swelling or fluid retention in your hands, feet, or ankles. Sudden weight gain, more than 2 pounds within 24 hours. Potential risks following transplant, rejection, and infection. Other signs and symptoms of heart transplant rejection or infection for which you must call us immediately. Flu-like symptoms, aches or pains. Low blood pressure or low heart rate. Pain in your chest when you take a breath. Cough with yellow or green phlegm or blood. Flu-like symptoms, aches or pains, nausea or vomiting, loss of appetite or painful belly,